Hi, Dr. Ruchi, you there?
Yeah, I'm there.
Yeah, most welcome. So, were you able to configure your desktop?
No,
No?
it's very
You
tricky. Anyway,
you want
I'm
me to share
sending.
the presentation?
Yeah, I'm sending you the presentation. It had some videos, so I had to delete those to make it light for you. Can you see me?
Yes, yes.
Okay, everybody is coming?
Yeah, they are joining it. We have at the moment around 30 participants, so 20, sorry.
Amazing. Just check, Mother. So receive my mail.
Okay, okay, I'm just checking. Hello. Yeah.
It's not exactly desktop, it's on the browser. I hope it works equally nicely. Can we test it?
Yes. I'm just downloading it. I have received your PPT. Okay, so I'm going to unshare my PPT and then I'll share your PPT because it has the first slide which I have sent you. So that makes the things very easy. I'm just going to stop sharing and then as soon as I share your PPT, we can have an intro and then we can get started with the session.
Yeah. So I'm seeing over here on my browser, I can see myself, but I don't see the share button out here.
Okay, so no problem. You can just tell me that go to PPT1. You can see the local copy of presentation on your desktop and you can keep telling that, okay, on the first slide, second slide, and I'll move the slide accordingly. Okay.
Sure. All right.
See if you are able to see PPT. Dr. Ruchi, can we get started?
Do you want me to put on my camera or we are good without that?
At the start, you can just put on your camera and then you can be, we can be okay without camera as well. At the starting, just if it is possible. Otherwise, it's absolutely okay if you are facing network issues.
All right. So I'm also able to share my desktop right now.
Oh, you are? Okay.
Yes.
So should I unshare and then you want to see if you are able to share it?
Sure.
Okay. So can you just try?
Can you see it?
Yes, we can see that. Yeah, great.
Amazing.
So, Ruchi, you are all set. Can we start?
Yeah, sure.
Okay, yeah. Thank you, Dr. Ruchi. I would like to inform my audience that, Dr. Ruchi is a doctor by profession, and she is into healthcare sector. It's actually she's using all the available technologies to bring healthcare to forefront. So during this situation, I think she is the real warrior, if we have to say. And she currently she has started her own company, and she's director of operations for that. She's in fact founder of Caerobotics Healthcare Solutions UK. Dr. Ruchi, for you, I would like to tell you that the participants that we have out here is a mix of faculty as well as students. We have been joined by our head of institution, Dr. Manoj Kumar Pandey. He is head of institution of Amity School of Engineering and Technology. And we also have with us Dr. Sujata Pandey, who is head R&D of Institution Innovation Cell, which is actually an MHRD step that our institution has also opened up Institution Innovation Council, where we try to promote innovation, and it is very, very much required in this situation. And so-called, with this robotics and so many advancement coming in, I think now the human being is required to be thinking out of box if he, as a resource, has to be in demand. So thank you so much for accepting my request. I would like, before we start, I would like Dr. Manoj Kumar Pandey, sir, to say a few words on this account. So over to you, sir.
Yeah, good afternoon to all. Good afternoon, Dr. Ruchi. And thank you very much for joining this afternoon to us. And we are keenly waiting for listening from you. And I appreciate your commitment that amid these circumstances you have decided to connect with us. And as everyone knows that healthcare is very essential service as today's convent. And now everybody is trying to how we can, as a engineer, as a technocrat, how we can contribute our efforts for anyway to the healthcare and so on. So as you are already in that field, so how you are feeling right now as per today's situation, how we as a technical people can contribute for welfare of the society. And thank you very much once again. Please kindly go ahead, please. Dr. Madhuri,
thank you
please.
so much, Dr. Manoj. Yeah,
sure. Thank you, sir. Yeah, please, Dr. Ruchi, over to you now.
Thank you so much, Dr. Madhuri, for inviting me here. And thank you so much, Dr. Manoj, for your kind words. Dr. Madhuri has already called me a warrior, a real warrior. Probably I'm not a real warrior. The real warriors are in the field, in the hospitals, in the roads, cleaning everything and ensuring that everything is all right. The policemen are probably the real warriors out here, not me. The only thing that I'm probably trying to do is get everyone together. And that's the least contribution which I can make to tell you where I am right now, I am in Kathmandu in Nepal. I'm not in India, and that is my
that's great.
biggest helplessness. Yes, I'm not in my own country. So wherever I am, you can call it stuck, you can call it safe, I don't know, but then I'm locked. And I'm here. Whatever I can do from wherever I am with whatever I have, I'm just trying to make the best use of it. It was a similar situation in 2015 when the earthquake in Nepal happened. I'm married to a Nepali. So the pain is quite relatable because when the Nepal earthquake happened, I was not in Nepal, I was in Mumbai. And there again, it was the same helplessness that you really want to help, but you can't help. And it all starts like that you want to do a lot, like this, what Sir said, that we as engineers want to do something, but we don't know what. So each of us, with all the knowledge that we have gained over the years, from our childhood till our professional education and working and experience, we all feel that we have learned something. And probably when our country needs the most, this is the best time to contribute to it. But the question is how? And can one person do everything? It's probably impossible. And that is the reason why we talk about interdisciplinary teams. It's impossible for doctors to just treat patients and take care of a pandemic like COVID-19. It is impossible for engineers to come in and say that we will give you all the machines and we don't really need doctors to do everything. Robots can do everything. No, it doesn't work like that either. None of us can say that we can do everything without the cleaning workers who are out there day in and day out ensuring that hospitals are very, very clean, or ensuring that the manufacturing of gloves and the masks are happening in time, or the vaccines are being made, or even the government to ensure that economic sanity is maintained when such a huge lockdown for a billion population like ours is happening. So we all have to work hand in hand. This is one message that we need to take away today, that it's impossible to say that just because I am a doctor and you are an engineer, we are superior to everybody else. Here, we need even the data scientist. We need not just the scientists, but data collectors. We don't have data today to tell that how many hospitals have how many beds occupied and how many are free right now. We don't have live data of that. We don't know in a particular town, in a particular ward, what is the population demographics that we have currently. How many of our senior citizens don't have any accessibility, any car, any modern phone calls? We are having chatbots, but do we know that if my parents in Mumbai can even use those chatbots if they have a cough today? I mean, I can feel my helplessness sitting in Kathmandu. My parents are in Mumbai. Will they be able to use the technology that we are trying to provide to them? So again, as engineers or as designers or as solution providers, we have to start thinking, whom are we designing for, whether they have the accessibility to it, whether they will understand what we're talking about, and whether they will make the use of it as intended. If the intended use is not met with, making whatever technology is going to be half-hearted. This is my opinion. I would like this session to be interactive so that I understand whether my thinking is right, wrong, anybody agrees, disagrees to it. And that's what I feel. Any suggestions from anyone at this point before I move forward?
Yeah, this is absolutely correct, madam.
Right. Let me give you a background of where I come from and what I do. This is my company, Caerobotics. The three words which are integrated in this name are care, aerial, robotics. And the need to use drones for healthcare and emergencies like what we are seeing today, and the helplessness of trying to help people wherever they are. For example, if I feel myself to be really lucky to have medical stores next door, wherever I am, we live in urban cities. But this is not the truth for 80% of the population of the world. That's the reason you need to have something which can reach to them when nothing else can reach them. Now, we're talking about COVID-19 today, when such a kind of lockdown has happened. But similarly, whenever you have floods, whenever you have cyclones, you have earthquakes, landslides, a lot of roads are blocked. And the only thing that can cross that barrier is not something through the road or through the land, it has to be from the aerial route. That is where the drones come into the picture. And why drones and not helicopters or airplanes? Because obviously, helicopter is very expensive. Nobody can afford that. And drones are something which can be made easily, simply, even by the local engineers. And this is the reason we said, let's have something wherein we are using technology to ensure that it reaches the people who need them the most. With that idea, we started this. And now we are into at least 3 main projects. One is education, where we are ensuring that we bring in the thought leaders from around the world and share their understanding about how drones can be applied for social good application. Project Wings is taking this education or learning to the schools, wherein every boy, every girl has a passion to use technologies like drones and then dream about having a career in STEM tomorrow, especially girls. Why girls? Because I feel really lonely in a lot of conferences which I go. There is nobody else talking about drones as a girl except me. So it becomes really lonely there. And I need more girls in my team who can talk about it. And that is again my appeal to all the institutions and the institution head, that sometimes girls may be shy because of the upbringing we have. But it is very important to give them the room to explore their talents and creativity and thoughts, because the way probably girl sees a world is slightly different. We are naturally empathetic and sensitive. I'm not taking that away from men or boys, but I'm just saying that giving them a voice is equally important.
मैं भी करता हूँ बच्चों को हो गए
Sorry.
Yeah, Dr. Ruchi, could you just come slightly more near to the speaker, because though the voice is very clear, but it's slightly faint.
All right. Is it better now?
Yeah, it's better now. Can it be still better? Slightly more?
Yeah, I'll try. I'll try to be louder. I'm just seeing if there is a setting over here which I need to change.
Uh, I don't think so that on Microsoft Team you would have some setting, but that's okay. I mean, I think to all the participants, are you able to hear?
Yes,
Is
ma'am.
it
It's
audible?
audible, ma'am.
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am. You are audible.
Okay.
Yes, yes,
Okay.
it
So
is
we can.
audible.
All
Yes.
right. Thank you so much. Thank you. And then the third important project that we are doing is called UAV Rapid Response Task Force, which again is of a thought that when disaster strikes, it is impossible for a team from a particular part of the country to reach the place where disaster is actually happening, or the affected population. It is equally important that the local drone teams from all the corners of the country must be empowered with knowledge and tools so that they can work with their own local government and solve their own local challenges. With this, we started India Flying Labs. We started as 4 companies partnering with each other, but now we are more than 35 organizations who have joined hands, and this number is growing every day. India Flying Labs is the India chapter of Flying Labs Network, which is in 26 countries today. Again, it's expanding every day. And this is superheaded by an organization called Robotics, which is an NGO, which is a mentor organization. So the idea is again the same, that how do we encourage local leaders to take up local leadership in innovations so that they can solve their own local problems. Now, what are the goals of whatever we are doing today? First goal is to bring professionals and organizations together to form a strong, dedicated, knowledge and resource sharing community that is keen on using technologies for social good. Now, as you must have seen, we do not have government directly engaged in this, because we are doing it as an informal group right now. We ensure that we are all having each other's back whenever we are doing something. There is a lot of encouragement which happens, a lot of passions which are driven into each project and each training program that we put together. The second goal that we are looking at is how do you bridge the accessibility gap and make technologies available to the communities who need them the most. As I say, if I have something in Mumbai, let us say I am a very rich child who has a drone, but what do I use it for? I use it for a hobby flying, or I use it like a video game. I get bored and I keep it aside. Probably there may be another boy in a tribal village about 200 kilometers from Mumbai who may need this drone for solving a real challenge. Maybe he can use it to map his own rivers, his own forest, to keep in, to understand what the biodiversity is, or just to ensure that all the houses in his village are marked. So again, how do you ensure that the technology reaches the people who need them the most? The third goal that we look into is coming together to solve challenges such as disasters, conservation, healthcare, and development. Each of these four areas cannot be solved by one individual or by one organization or one institution. You have to join hands together, do it like a crowdsourcing where everybody helps everybody else and then solves major problems together. Over the last 1.5, 2 years, there are a lot of events and trainings which we have conducted, essential meetings and demonstrations. The very first project that we wanted to do was also a kind of experiment, but a tiny promise in a small tribal village in Dahanu, in near Mumbai, just to see whether how do the tribals like technologies like drones? Do they really enjoy them? Do they want to learn them? Do they understand them? Is it easy for them to use it? And that is where we used again the drone from an Indian company called Idea Forge, again to encourage Indian innovations, and it was very successful. After that, we were on a roller coaster. We had meetings for Rapid Response Task Force. We did a co-creation workshop in IIT Delhi. We used drones for mapping the untapped water potential in a village called Malvan. We even did vaccine delivery demonstrations in Papua New Guinea. And after the cyclone in Orissa, we used drones to show how disaster damage assessment can be done using drones. When Maharashtra floods happen, Punjab floods happen, Karnataka, our teams were out there. We did more workshops for Nagaland and Odisha to make them understand how drones and data work during disasters. So, talking about COVID-19, especially, what are the areas of innovation in the current scenario? I have listed down about 12 blocks over here, which immediately come to my mind, which currently need some kind of innovation. Now, why do we need innovations in COVID-19? It's because necessity is the mother of all inventions. We have never seen a pandemic of this size affecting the entire globe. Obviously, whatever we currently have is not enough. That's where we need to step in and say that let's innovate. Now, again, why innovation? You need not invent something absolutely new. It could just be a new application of something which already exists. To give some examples, probably one by one, if we go about. Now, in screening, how can innovations really help in screening? Maybe I can have a couple of ideas coming from the crowd itself. Has anybody seen something very innovative in terms of screening? I have seen chatbots being used by Apollo, which have become really interesting. But again, the question is, will everybody use it and how will you make use of it? The second level of screening could be when you have to reach out to masses. You talk about a place like Mumbai or the hutments of Delhi NCR or in the surrounding areas where you know that the people are not as educated to follow your chatbots. How do you ensure that you have conducted mass level screening and everybody is covered? You have data of everybody and every data has a kind of a relation chart attached to it. I'm talking about blockchains over here. Can we use blockchains to do a mass level screening exercises across the populations? I'm throwing these questions at you. Probably one of you might pick it up and start innovating on these ideas. Next is tracking and tracing. Now we know that the contact tracing had become a very popular word in the last few days. How do you ensure that anybody who has come in contact with an existing patient or a potentially infectious patient or a case is traced and tracked so that you are able to follow them up very well on all the symptoms that they have, and before the disease becomes severe, you have them isolated and treated. We have seen similar technologies being used at the airports where the data was collected and followed up, but probably we may need something more than that. Testing. So we are seeing the rapid tests coming in very quickly. But besides that, if for confirmatory test of COVID-19, maybe we need something happening over there. Even in terms of treatment. Now, the treatment protocols which are being suggested by WHO, maybe they need to be adhered to. So there is 100% treatment compliance available, or they may need to be modified. Doing a validation tests, what treatment is working and how much. So you would need technology even in that area to ensure that every patient who has been treated The case histories are recorded digitally, and all the cases across the globe, we are able to study them longitudinally to ensure that every treatment protocol that is being suggested has been verified. I don't think this kind of a tracking of treatment protocols is being done across the globe right now, but I'm not sure. But it can be done and it can be proposed. Disinfection, large-scale disinfection exercises of all the hospitals, of households, of communities, or even indoors. It is being done in different ways. The latest that I had seen was a UV robot. They found out that UV rays are the best way to sterilize a particular isolation ward or a hospital room. Now they're using robots to do that because we don't want to risk humans to get interacting with the UV rays. Situational awareness, we are using drones for this, of understanding what is happening where are the people, what kind of crowds, is the lockdown being ensured. The other ways of getting a situational awareness is again mapping. If you are able to use satellite data for mapping a particular settlement, let us say I take Dharavi in Mumbai, it is a huge slum area. If I'm able to map the entire hutment as a 2D model or a 3D model, and then understand that how many households do I have, where exactly do I need to put my screening booths, where exactly do I need to put my public announcement systems, where can I start creating the hotspot uh, isolation areas, or where I can say that probably this is the area that we're talking about. How do we move forward? Doing a little more situational awareness using technologies is what something we can start thinking about. Sorry.
दीदी वो क्या है 34 hours on Duolingo? 34 hours Duolingo एक सेमेस्टर में आप जो सीखते हो एक सब्जेक्ट कोई भी उसके बराबर है.
I'm sorry, we are interrupted by some voices in the background. Can you have everyone at mute?
You may please move, ma'am. Yeah.
Yeah, thank you. Okay, and mapping. Mapping, I'm talking about drone-based mapping as well as satellite mapping. There again, we need to start thinking about crowdsourcing, because one major map of India, today we have maps which are showing how many cases we have across the country, state-wise and district-wise. Probably now we will have to start talking about our own local areas. That let us say if I live in a place called Mira Road in Thane near Mumbai, there have been a few cases out there. So within how much do I know my Mira Road itself? Within my Mira Road, if this is the particular society which had a case, which are the areas around it? We have some more voices in the background.
ये कहता पता नहीं यार कौन आता है बढ़ना बताना कौन है यार हेलो
ये डॉक्टर एसएम
ठीक है मनोज तुमसे
Okay, I'll go forward. All right. So talking about mapping, probably we should start thinking about our own local towns where we live. How much do we know about our towns ourselves? Where are the vulnerable populations? Where are the senior citizens? Where are the population who are below social? Hello, I'm echoing. Okay, so where are the people who are below the poverty line? Or where are the healthcare facilities? Where are the testing centers in my own area? Where are the medical stores? Where are probably the groceries where I can go and buy? If each of us starts doing a crowdsourced mapping for our own areas as volunteers, then probably we can have a large scale map for all the places. And again, this cannot be done individually. Understanding what GIS and maps is a very simple thing. You can conduct courses for volunteers, teach them over a few days, and then give them the task of doing it in a large scale manner. Again, technologies are being used for crowd control. Drones have been playing one role in that. There could be other ways of doing crowd control by public announcement systems, or by talking to them, or I don't know, we'll have to still figure out, because this is a major problem. It's very difficult to control the crowds when they start accumulating. Talking about production has to scale up for things we never thought would need so much. We would need so much. For example, gloves or masks or face shields or aprons, or it could be just anything. It could be drugs, it could be vaccines. So how do we scale up the production without using technology? It's impossible. Now, when everybody's in lockdown, we know that the entire world needs something much. So again, even if India doesn't need it as much, maybe we can start making and sending it to other countries. But then how do we convert our existing production facilities into something else? Like some companies had done that. If they were making perfumes, they started making hand sanitizers. If somebody else was making something else, maybe a fabric, they started using the same machinery for making the PPEs. So again, it's about innovation, right? How do you use your existing resources into creating something which the world needs right now? Production is not enough. You also need to start thinking about distribution. How do you ensure that each of your hospitals, each of the clinics, each of the health workers, ambulance workers, or even the concierge services, for example, if you need a ride, maybe a bus or a car or something, how do you ensure that all the drivers have enough PPE, whoever is interacting with the public? Or it could be the volunteers who are going door to door and asking questions about the symptoms or ensuring that everybody is safe. We need a lot of everything. And how does the distribution happen across the supply chain? Delivery. So here I had seen some delivery robots wherein, because you want to maintain a social distance, you don't want to pass the parcels directly to the hand. So they're using some robots to ensure that the 6 feet distance between the people is maintained, and the delivery robot can complete the last mile delivery. It could again be drones, or it could be crawling robots, or the robotic carts which can do that. So something can be done even in that area. And talking about capacity building, suddenly we have a huge capacity gap in terms of we need more healthcare workers, we need more enumerators, volunteers. Government of Maharashtra is appealing to everybody to come and help the government of Maharashtra in addressing these issues, that we need more people on board and we need capacity building. So now we see that e-learning has become a very good way of teaching everybody online wherever they are. Now, how do we create more course materials for exactly what we need? Now, for example, if you talk about a municipal corporation worker whose only job is to sanitize the streets, or to ensure that wherever the people have been, you clean up the entire area, maybe a couple of times a day. How do you create a training program for him in his own language so that he understands what COVID-19 is and he's able to address it? What about the female health workers who are working in villages? We need specific programs for them, or we have to give them tools in hand so that they can go door to door and do the follow up of all the people within her community to do that. Right? So capacity building using technology has suddenly become very, very important. We are using technology to reach out to our drone teams. We have more than 200, 300 drone professionals across the country whom we talk to on a regular basis. And these technologies, the video conferencing technologies, which must have existed for so many years, have suddenly become so important for us. Now, why do I keep talking about drones so much? One, it's because, of course, they're unmanned. So wherever it is very risky for people to go, to step in, drones can become priceless. Second, they are portable. Why am I insisting on portable here? It's because CCTV cameras are fixed, they're not portable. Satellites are inaccessible. You cannot make them focus exactly where you want them to focus. It's not in our hands, it's not accessible to us. Drones are easy to learn and easy to deploy. Seriously, they're very easy to learn. I, as a doctor, I fly drones. So that's the reason I say if I can do it, anybody can do it. They're very efficient in terms of the data that they produce. They fly enough and they look at the situation through an aerial perspective. So when it is impossible for us to go from every lane to every lane, figuring out what's happening, we get a two-dimensional or a very narrow view of whatever we are looking at. Drones give us an aerial view. They give us local data. Again, where the satellite data is for the entire country or for a whole region, Drones can give you exactly local data. So if you fly it, it can give you the 2 square kilometer data that you want for taking your local level decisions. They give precise geospatial data. Every point on the drone image is geotagged. You can come back to these images later, or you can take 2 more images in the course of a timeline and then study what has happened over a time series. So what had happened on day 0 and then day 5 and then day 10, and then you can study the effects of something. It could be in a disaster like floods, where you take similar images over time of a same area, and then you study whether they have what is the kind of progress. It could be the flood either receding or progressing. It could be the damages to houses. It could be damages to roads, or it could be anything else. This is how we have been using drones in disasters. And they integrate very well with artificial intelligence and machine learning. We use drones for counting houses, for example. So if I count every house, I might take a long time. I may have huge data with me. Maybe I have mapped about 100 square kilometer. So I cannot keep counting every house myself, but I can train a machine learning algorithm that this is how a house roof looks like, and this is what you're supposed to count. And then you give the task to the artificial intelligence, and they do that counting amazingly. We can also use these kinds of algorithms to study something. For example, if now we're talking about crowd, so what does a crowd look like? Two people together becomes a crowd. Or what is the average distance that we are trying to see? If people are at a distance of 6 feet to each other, it's okay. If they cross the distance, then there is a red mark coming in. So these kind of alerts can be embedded within the drone images or videos or stills that we produce. The next few things are in asterisk and italics. It's because it's completely dependent on who uses these technologies. Technology is just like a matchstick. You can use it to light up a lamp, or you can use it to light up a house. I mean, just put up a fire. So the safety, the privacy, the security, affordability, and availability, it all depends upon who uses it where. They can be a great community engagement tool because wherever we have gone, we have seen people to be extremely curious about drones, and this draws in the crowds. Then you can talk to them about something and you can explain them something. They become good community engagement tool, but provided you do it. If we feel that just because we have drones, we become the masters of people and we can fly them on their heads without their permission, then sorry, we are wrong. This is not the way we should do that. People who we picture or we video in whatever camera, they have complete right on the data that they are giving to you. So they should be a part of the solution, not just adding to it. I hope I make sense. Whenever we are making something for people, you have to have a human-centric angle to it. Humans or people or whoever you're talking about, if you're talking about forest, then it's important to ensure that whatever data you produce, it doesn't inadvertently affect or there is any misuse of whatever you do in any way other than that, what it was intended for. The same thing goes for the patient data. Now we are talking about data for tracing and for tracking, but this is very sensitive data. How do we ensure that the same data is not misused for something else in the future? These are some of the ethical considerations. But overall, as I told you, in any kind of emergency response, be it disasters or be it public health emergencies, drones or unmanned aerial vehicles have been very useful in increasing situational awareness. We have used them for search and rescue in floods. We have used them for mapping, for doing damage assessment, for counting the number of houses which are damaged, or for even classifying them, which are the houses which are slightly damaged or majorly damaged or completely damaged. This kind of a differentiation can also be done using the drone data. Monitoring changes, if it was something like this on day 1, how is it on day 2 or day 3 or whatever. Delivering lightweight essential items to unreachable locations. Now, this is slightly difficult in the current legal scenario, but this is why I got into drones. The day that happens, when my medicines reach the people, I'll be the happiest. But I'm waiting for that day to still happen. Here we're talking about localizing the drone-based emergency response because we want the local drone pilots, local drone data management, local missions with the local government in the local context. We don't want to really standardize everything that's saying that if something worked in Mumbai, it will also work in Gujarat. If something worked in Gujarat, probably the same thing will work in Delhi. May work or may not work because people are different, cultures are different. I may not understand what happens in Odisha, but the people from Odisha definitely do. So understanding and involving the local teams is very, very important in whatever we do. More than just involving, the best part is if you empower them, you give them the rights, you give them the responsibility to reach out to their own local government and start their own local project. This is the best model which has worked for us, and we will be taking it forward as well. Talking about crowdsourcing here, we are crowdsourcing the drones, the drone pilots, the drone data. We had an understanding that across the country, there are more than 6 lakh drones currently available. Understanding that, and if the pilots can be motivated to use their drones during emergency, and if they can be guided to proper SOPs, policies, guidelines, checklists, whether they can do it or not. So it was an experiment for us, which we are currently doing, and it is pretty successful. So we are not traveling across the country. Whoever is wherever. So if people are in Ahmedabad, they will fly for Ahmedabad. If people are in Bharuch, they will fly for Bharuch. People from Ahmedabad will not travel to Bharuch. We are going a few steps beyond that. I don't know if I can show you this one. This is the map of Ahmedabad. These are all the teams within Ahmedabad, the local drone pilots from various locations. Wherever they were, they flew the drone, and then that was aggregated. The entire data was aggregated on the central command and control screen with the local police, with the police commissioner and the government. So this was a crowdsourced data. You not just get, we're talking about lockdown, but we're also getting some more information out of it. That, okay, where are the settlements that we need to probably focus on? Which are the red hot areas that need more focus? What is happening there currently? Okay, if I'm able to show you this video, this is from a small village in Madhya Pradesh. There are a group of boys out there who make their own drones. They found that they had only 2 medical stores in their village, which are near the highway. But people again are in the lockdown and not everybody can come to the medical store. So this is what they did. And they supplied medicines to more than 50 to 100 people on day one itself of these drones. So the idea is if you allow and if you trust your local drone innovators, not just drone innovators, but any kind of innovators, we have frugal innovators in India who can come up with guard within a day or two. If we allow them, if we trust them, if we empower them to do that, they probably would do a very good job with whatever they have. It may not be very fashionable or fancy. We can all start questioning about how secure they are, whether they will fall on people's head or no. But we saw that it did not. They're pretty safe and they've been tested, right? Somewhere, probably the policies and the minds of the government and of the communities need to open up to technologies, create more acceptability, and the acceptance will come only when we prove that they are being used for good. The good part over here is the good itself. That where are you using it? What is the intent? And how nicely or how safely and ethically you are doing it. It all depends on that. This was what one of our teams in Drone Federation of India is doing. They have created this kind of a portal for all the crowdsourced efforts. Again, for example, places like Mumbai and Delhi, where we have 30 to 50 pilots who are on the field collecting these kind of images for the government. They can just simply upload it on a particular drive which has been created, and this is directly shared with the police. So police will get precise data from all these places. They will know exactly where they are because the Google Maps is attached over here, and then they will be able to act on it, or at least understand that this is how the situational awareness is happening. So this is a short presentation how we are doing it. I'm absolutely open for what more ideas others may have, what others are doing, and what we can probably do together. Thank you so much.
Hello, ma'am. Can I share my ideas with you? Hello.
Yes, please.
Yes, ma'am. I'm Vipin Kumar. I'm personally MTech from Amity. I'm also working with some Delhi-based drone company like Better Drones, Indian Robotics Solution, and I'm also a drone developer and pilot. And in last few days, I also work with Zomato like as a drone pilot for volunteering the society to check up the like हमने सारा सब कुछ चेक किया था नोएडा में सबने हमने उसके साथ में मिलके वॉलंटियरिंग की है अभी हमने इंडियन रोबोटिक सॉल्यूशन के साथ में मिलके हमने नॉर्थ एनडीएमसी के साथ पूरे नॉर्थ दिल्ली को हमने एग्रीकल्चर के थ्रू डिसइंफेक्ट
वेरी गुड विपिन, बहुत बढ़िया.
थैंक यू
Excuse me, ma'am.
जी.
Ma'am, as we are aware that as per the regulations or all the advisories or the rules which are framed by the government, especially if we talk about areas like Lutyens Delhi or areas near Kolaba and Hotel Taj and all, which are sensitive places, there we must have heard flying drones is not allowed, or if allowed, it's allowed only when if you have taken a prior permission from the police, right, ma'am?
Exactly.
So, ma'am, how would that can be modified, or can we make changes, or how can we motivate people, or how can we get motivated so that we can fly drones, or we can empower people, normal people, to fly drones or be drone pilots?
So there are two aspects of it. If you're talking about the current emergency, you're talking about generally. If you're talking about the current emergency, the advice that we have given to all our local teams is work only with the local police. So the permissions that we are getting is from the local government itself, the chief minister's office, the state home minister, and the police. So it is working in tandem. So nobody is doing it ad hoc. I'm not encouraging ad hoc flying. I'm saying that we are all coordinated and we are crowdsourcing everything as a coordinated, aggregated effort. I'm not saying that everybody should just start flying drones tomorrow. No, that is not recommended. But yes, be a part of a bigger solution by offering what you have, proposing it systematically, and then getting a written permission for whatever you have been asked to do, and do it only in the places where people want you to do, like the government wants you to do. They have already identified the red hot areas or the vulnerable areas. That is where they need help. We are not saying that we will fly in Newton's Delhi because we want to. No, we don't want to. Why do you want to? It's a very safe area. The place which needs attention is probably the north of Delhi or the east of Delhi, or probably the Ghaziabad area, where you know that if something breaks out, it is very difficult to control it because of the density of the people living there. That is one thing. And the second part of your question was, how do we become drone pilots? It is a process. You need to first enroll yourself in a training program, which is DGCA recognized, and then you get certified. Then if you want to fly for India Flying Labs, then again you need to put in certain number of experience hours. We provide additional training programs in the professional applications, especially the mapping, in the safety, in the ethics, and in the command and control of the entire project. So we are a very mission-based organization. So for us, those things are extremely important.
Thank you, ma'am. Ma'am, one more question.
Yeah.
Ma'am, as per the presentation, you said that I suggest you have outsourced the drone maintenance part as well, right, ma'am?
Drone maintenance.
Yes, ma'am. Drone maintenance, or you have acquired some technicians or trained people so that you guys can maintain the drones, because after all they are sort of machines, so they require maintenance as well, right, ma'am?
The drones that I'm talking about currently are either the box-packed, easily available drones, or they are the drones which people are making themselves. So the ones who make themselves can obviously repair them. And secondly, my company doesn't own a single drone. These are all the drones which are there with people already or with the organization. All that we are doing is helping them coordinate amongst each other, bringing them on one platform, ensuring that the safety part or the ethics part of it is well taken care of, so that nothing is misused or abused.
Okay, thank you, ma'am.
Yeah, thank you so much.
Ma'am, I wanted to know, like we talked about drones a bit, but is there any other solution other than drones? Like, can we use basically like normal robots, like vehicles?
For which application?
Like, ma'am, in the application, I was talking. The context was that, like, if we're talking about a particular state like Delhi or Maharashtra or any other state, ma'am, we have got good roads and like we don't have any situations where we can't use a robot vehicle. So, ma'am, can we use a robot vehicle in that? And if we can, then what are the scope? What is the scope of that thing? Can you please explain a bit?
Robo vehicle. Are you talking about like driverless car, or you're talking about something else?
Not exactly driverless car, like a basically a robot, like a car which is not exactly the size of a car, but you can use it to transport goods or take samples to one place to another, something like that. A remote control car, basically, not that small though, but something like that. Because I read an article in Spain, they were using robots to take the data from the people who are infected, so that the people don't get in contact with them.
What testing out? What testing out?
Uh,
I was looking at a drone, not a drone. I was looking at such similar kind of tiny cart which they had made for delivering water to villages. So they were kind of studying how do people interact, how do villagers, absolutely uneducated people who have never seen technologies, interact with these robots. This was in South India. And this was done to study if ever we need to use such kind of robots to deliver water to the households. Will they like it? How would they perceive it? Whether they would like to subscribe to it? They were studying all that. The same company, it's not a company, it's an academic institution, a research institution. So the same researcher made another kind of hand washing robot, wherein the simple thing was there was a camera with a sensor who would see if there is anybody washing the hands. They would start instructing them that this is how you should wash your hands. You didn't wash it for 1 minute. So this was one simple thing that they did in a very small village school, which was a vernacular language school. So they were seeing whether children liked that kind of a robot, which looked very cute, which talked in a very sweet language. So to test it out, they were doing it actually manually. So there were people sitting behind the camera who were interacting with the children. But the idea is, if you are able to convert this entire thing into a model, a self-learning model, whether the people will interact with it nicely. So here we're talking about every kind of robot that you can conceive with technology, but then come down to it, how will people perceive it? The people that you are designing it for. Which kind of communities are you designing it for? Who is your ultimate beneficiary? So you have to study that. Yes, you can make a robot that you're talking about. Maybe make it, test it, experiment it, and see how it works, and then start proposing it. Obviously, it's a very good idea.
Okay, so ma'am, like in the army, there are people using robots for checking if there is a landmine. So my question is that is there any such kind of a thing which we can build or create to help the situation in our country right now? Like the whole, how can we like tackle COVID-19 using robotics? Like as in not with the drones situation, but something else like on land.
Anything. Start thinking about these ideas, sketching them out. And I don't know if you know that there is a online competition being held, a hackathon. It is called Samadhan by AICTE. I'm one of the mentors there. So this will be held, I think, in the next week or so. And all the students are welcome to be a part of that. Maybe you can start preparing for it right now. Start creating your designs, your sketches, putting up some basic prototypes, a very low cost prototype, or maybe just something which can be seen or viewed by people, that okay, this is how exactly a solution might look like. And maybe you can start pitching your ideas. There's nothing wrong. And a lot of grants and funds have started stepping up in this area, encouraging students or even innovators to start pouring in ideas, because now is the time. And if you propose something which works, probably it will be accepted also. Because in a similar hackathon 2 weeks back, no, not 2 weeks back, about a few days back, there was a similar hackathon, again by Forge Accelerator and MHRD. And there somebody had proposed a UV robot, which was liked. They were one of the finalists there. So of course you can start proposing these ideas. Why not?
Okay, ma'am. Thanks a lot.
Yeah, thanks.
Yes, any more questions? Any more questions from the audience?
Well, I am Dr. Sujata Pandey.
Hello, Dr.
I must
Sujata.
thank you, Dr. Ruchi, for giving the insight into a very technical area where student can step in. And yes, definitely in the beginning, as you said, that more girls need to go into these areas to look for opportunities and all. And the Institution Innovation Council of MHRD we are running here. And in one of the activities in like Smart India Hackathon, they have made it compulsory that at least one member should be a female. So in this way, government is also giving a lot of opportunities for the girls so that they also come up in the technological areas. So I thank you, ma'am. I thank you. So your work was very informative to all. And
Thank
I
you so
think
much.
the students will again start thinking in these areas, what are the possibilities and opportunities available where they can put their thinking into and do some designing. Well, thank you. Thank you all the faculty members and participants. And we look forward to meet you in the campus also, ma'am. So whenever our campus reopens, we will definitely invite you in the campus and our students can interact directly with you.
Thank you so much, Dr. Sujata. I hope to see all of you face to face very soon.
Yes, okay.
Oh, thank you. Thank you.
Thank you. Thank you, ma'am.
Thank you, ma'am. Thank you,
Thank
Dr.
you so
Rishi.
much.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, everybody. Thank you for joining in today.
Okay, let's go.
And all of you can keep in touch with me on Twitter, on Instagram, on LinkedIn. You can find me there, and we can continue the conversations.
Yeah, Dr. Madhuri, she has given us your LinkedIn contact. So
Yes,
we will
please.
definitely be in touch with you.
Thank you so much, everybody.
Ma'am, I really wanted to know that you told us about the AICTE contest. Ma'am, can you please give some more information about that if you want to participate in that?
Is it always? Is it always?
Yes, ma'am. Yes, ma'am.
Okay. So the last date to apply in Samadhan was 14th of April. And it was a very quick contest. They had given only 4 days to look for suggestions. And I think on 24th, they are giving out the result this month only. So it was a very quick kind of thing. So you can visit the website, AICT website or MHRD website. In both the websites, Samadhan details are available.
Great.
So if still they have some time, I think you can also apply if they extend the dates and all.
Urge them to extend the date, and maybe you can write a really passionate email to them that I really have an amazing idea. You cannot ignore my idea. Please take it. Then probably they will. If not, then let me know. I'll talk to the organizers.
Always, I will send you the details. Okay.
Okay, thank you, ma'am.
Thank you.
Thank you all.
Thank you so much.
Thank you so much for your time. Yeah.
Thank you. Thank you, Dr. Madhuri.
Yeah. Bye-bye.
Bye.